This is PT Pro Talk, the podcast for physical therapists who want to improve their clinical skills and be more successful. I am Mariana Parks, physical therapist and your host, and today I bring you my conversation with Deanna Oliver, where we talk about how to empower our patients with Activator Poles. In our discussion, we talked about what pole walking is and its benefits, what Activator Poles are and how they differ from other poles, what the Activator technique is and how we can use it in our clinics, the benefits of using Activator Poles in general and as an alternative to canes, walkers, and crutches, what the urban pulling technique is and what it's used for, contraindications for using Activator Poles, and more. Deanna is a dynamic business professional with extensive background in marketing, sales, and fitness. She has a passion for promoting the many health benefits of urban pulling, which comes from her personal experience. In 2014, she became co-owner of Urban Pulling. If you find this conversation informative, please subscribe to our channel, hit the notification bell for updates, give us a thumbs up, and share this episode with colleagues who could benefit from our insights. Thank you for tuning in, and let's dive into the discussion. PT Pro Talk is only possible with the support of the forward-looking and innovative companies like
Welcome to Urban Polling. Discover the Activator program and polls for rehab and balance.
Sarah Health. Skeptical? I was too. But with Sarah Health, you will be as pleasantly surprised as I was. They focus on simplicity, no complicated apps for your patients to download, just streamline RTM. Hi Deanna, welcome to PT Pro Talk. How are you today?
Hi, I'm great. Thank you so much for having me.
Awesome. So let's get started talking a little bit about yourself, your background, and how did you get to where you are right now?
Thank you. I have a business background, so that's what I went to school for, and some experience in the consumer packaged goods industry out of school. And then I took a little bit of time off when I had my daughter, and I began teaching Pilates out of my home. I opened a fitness and wellness business, and I brought in other practitioners, yoga and massage and things. And one of the feedback that I had from a couple of my clients was it'd be great if we could do something a little bit more cardiovascular in nature. And so I started looking at different opportunities. I didn't see myself teaching aerobics per se, but then I found Urban Polling, the company. And I started looking into it and I thought, you know what, this could be something that I think certainly would catch within my client base. Slightly, older woman looking to maintain her fitness, but also feeling her joints and things. And so I decided to take the certificate course at that time, become an instructor. And that's how I became introduced to the company and the overall form of fitness and wellness and rehab that this is. And then fast forward a little bit, I became a partner in the company, and now I am the sole owner of the company.
Okay, great. So let's start talking a little bit about, what is pole walking and what are its benefits?
Yeah, so when you're walking with poles versus when you're just walking alone, you're activating about 90% of your body's muscles versus about 40% when you're walking without poles. And so now you've taken walking into a full body muscle engagement. So you have your core muscles activating, you have your upper body muscles activating. And that's what a lot of people don't realize. They wonder why people are out there with their poles. At the end of the day, this is now making walking also a resistance activity, because every time you're pushing through the ledge of the handles, in the case of our poles, pushing through those handles, you're activating your core and upper body muscles. And it's about 1,800 abdominal contractions per mile, which is substantial. And because you've now got all those extra muscles engaging, at minimum, you're burning 20% more calories, up to about 46%, depending on how fast you go. So really, you're combining specialized poles with your walk to allow for a full body muscle engagement, and you're getting aerobic and anaerobic training within one form of exercise.
Yeah, and before we start talking about it and I start studying and looking into it, I just I saw people doing hiking with those poles, and I thought like that's for, help on hiking. That was the only thing I knew about it. So it's just good to think about a different way of how you're engaging a lot more muscles when you're walking and getting more out of your regular walk, right?
Exactly. And that's the thing. I mean, you can certainly use the poles, in a, like you said, in a hiking setting, but you can also use them just around your neighborhood, in a local park. And that's what makes it so amazing, is that really the gym is wherever you are, because you're getting this phenomenal form of exercise. And again, for some people, if their balance is compromised, if they have concerns over falling, certainly the poles and definitely, our activator program can help to support them differently so they feel confident actually going around the block. That's one of the biggest things when people stop moving, stop wanting to go out. It's because of a fear or pain that they're experiencing, orthopedic pain. This helps to alleviate a lot of that.
Good. And you mentioned the activator program. So what are the activator poles?
So the activator poles, very different in design from our urban poles, which is a more fitness proposition. The activator poles are more similar to a cane in terms of a button lock system. They have a flat base, so a wider base of support than you would find on an ordinary type of pole, and offloading of about 200 pounds per pole. So really, if somebody with some type of chronic condition is in need of more support, perhaps a candidate for surgery, post-orthopedic surgery, hip and knee being two that are typically used for our program, the activator poles are designed to be able to support you. The same thing as for neurologic conditions. Somebody that has a neurologic condition where balance and gait are compromised, we don't necessarily want to propel them forward, which is what the traditional urban pole walking technique is. We want to support them. And that's where the activator poles and technique come into play.
Okay, great. So what is the difference between like a regular pole and the activator pole? Like this pole that we see people just walking with.
Absolutely. One of the biggest differences is, and I'll just show you here as well, is that we have the ergonomic handles. So these poles have been designed by an occupational therapist. And everything that we've done is sort of through that lens. So very different approach to what you would find within the marketplace. You have the ergonomic handles, which allow for alternating grips, so the top as well as the sides. You have this ledge here, which is maintaining the wrist in a neutral position. And that's really critical, especially when you think about it from a therapy as a therapist, physical therapist. Applying pressure on a non-neutral joint is not ideal. So that's why other poles where they have straps and things, first off, the straps are contraindicated in terms of injury. So research supports that you're at a higher risk of, for example, skier's thumb. If you do happen to fall and you are stuck to the pole, you can break your thumb, your wrist. And I think that's, for any age, obviously we don't want to have a break. But as we get older, certainly a fall and something like that could be far more detrimental. And so versus being stuck to a pole with a strap, if you are going to fall, even though this is very safe, right? If you are going to fall, you don't want to be stuck to a metal rod. You want to be able to release the pole. And that's the benefit of these, strapless by design, all through the lens of efficacy and safety. The button lock system, as I said, for somebody with arthritic hands, makes it much easier to put in place. And also, once that button lock is in place, it's not going anywhere, right? Similar to a cane. Versus a lot of the twist poles on the marketplace, not ours, our urban polling line does have a twist lock, but it's a premium locking system. Others' primary complaint is that the poles will collapse. And when we first came to the US market, we went to our very first physiotherapy conference, the APTA CSM, and we were absolutely swarmed. Everybody said, we love the idea of walking poles because of posture, because of that bilateral support. You're not off to one side as you are with some other devices. What they said was, but they rattle, they break, they this, they that, because the manufacturers producing those poles were not catering to this market. We're not catering to the physical therapy clients, the occupational therapy clients, the seniors living communities where a collapsed pole could result in something far worse. And so that's why the difference in our design has really allowed us to succeed, in this space, in the older adult market. And while I've used the poles, since my early 30s, my daughter started when she was 3, the reality is that our strength is in the older adult market. And as I mentioned, just the difference in the tips alone, where you have a high quality rubber, it's not plastic, it provides anti-vibration, the wider base of support, all helping to improve the experience for the end user. And again, thinking about it from the standpoint, as I mentioned, of the anti-vibration before, a lot of poles don't have a sophisticated anti-vibration system, if any at all. And so every time you have to imagine that pole is hitting the ground, it's rattling back through the body. And again, that's not ideal. That's not the kind of experience that people, certainly older adults, deserve. And that's why we've taken such care at the engineering of our products to ensure that they are of the highest quality and the best user experience overall.
Very good. And so what is the activator technique? How do you use those poles?
So the activator technique versus the traditional urban poling, ordinary pole walking, or Nordic walking, as some people say, technique, is that the poles are always maintained perpendicular to the ground. So they're never on an angle. The idea of the angled technique is for somebody that's pretty well healthy and fit, balanced, really importantly. We're okay to propel them forward because it's going to allow for them to be pushed forward, get more of a fitness accelerated workout. Somebody that has a condition that's rendering their balance compromised, we do not want to propel them. We want to support them. We want to help them offload pressure, restoring their gait. And that's where the activator technique comes in. Perpendicular to the ground to support balance and offloading, as well as posture and upright symmetrical posture.
Since you're talking about balance and posture, so in which ways that we can use the poles in our clinics and what are their benefits?
Absolutely. So we work with many clinics really all over the world now. And a couple things, restoring gait. So especially for people that have a neurologic condition like Parkinson's or MS, where, the shuffling, the varied gait pattern begins to come into play. The poles in the activator program really encourage a wider stance, more extension, such that there's less shuffling in the case of Parkinson's, allows for more reach. Really, they're providing, if you think about it, a visual, a proprioceptive, even auditory cue for every time. You can say to somebody with Parkinson's, extend that arm a little further forward, but that's all very vague for someone. When they can feel it and they see through the poles where that extension is meant to be, it creates a very different experience for them. It's almost goal-based. And so that area has been significant, but everything from pre-orthopedic programs or orthopedic surgery, so pre-post hip and knee, as part of a prehab program. Again, if you're thinking about somebody who's going to get any kind of surgery, part of the surgeon's protocol typically is possibly weight loss, which this can help to support, right? Pre-surgery, better outcomes, but also improving flexibility and improving muscle mass. So through this program, you can begin to build more muscle. You have the opportunity to continue moving, and that muscle memory extends beyond surgery. And that's why post-orthopedic surgery, the poles are reintroduced when offloading is permitted to be able to continue that program. And versus other devices where, you're off to one side, or in the case of the walker, you're, hunched forward. This supports better posture. And again, beginning to take you back to that ordinary gait pattern that you had pre-surgery and also pre-injury, whatever that was. So I would say in a physical therapy setting, Neurologic conditions, absolutely, for gait retraining. Pre-post orthopedics in terms of restoring movement, building muscle mass. And then just generally for the older adult who's really concerned about maintaining their balance and their base of support. The poles have been instrumental. The Activator program has been instrumental. And you have to think, what really drives our balance, our base of support, is our core. And so maintaining core strength within that area is so critical as we age, because that's going to help us with our balance. And it also helps us with our posture. It avoids that kyphotic posture, which naturally impacts our walking patterns as well.
So like with the poles, you're automatically engaging your abs, right? Because of the way you're using. So you're activating those muscles to help with stabilization.
Absolutely. And that's whether you're seated, standing, or ambulating. So even pre-gait exercises where you're working with somebody from a chair position, bringing them up to standing. So there's a lot of functional exercises that you can do. And I think that's the biggest thing, is that, really employing a sense of self-efficacy and autonomy, and they feel like they are capable. And this is the other piece. Oftentimes when patients go to a physical therapy clinic, there's so many wonderful opportunities for them to leverage equipment that they don't necessarily have at home. And so it's challenging. That transition from clinic to home can be challenging in terms of maintaining the program. Whereas with the poles and the Activator program, when they're introduced by a physical therapist, they do translate to home. And you can continue with that protocol very easily. And it's not a significant investment. You're not asking them to go out and spend $1,000 on a treadmill. You're saying, here, take these, fairly affordable, just over $100. And you can continue to maintain that program. And then, of course, checking back in with a therapist to see how you are progressing.
Yeah. And then I remember a few examples that I saw, that people even exercising in the clinic, but being able to maintain good posture while performing the exercises. Like sometimes they are away from like a surface that they can hold. So yes, they're not able to maintain that good posture, that upright position. So they have something to just support them while they're performing the exercises as well.
Exactly. It's far better than using the back of a chair. It allows you, again, to feel as though you have more of that control. And again, your posture is maintained. And every time, if you're just standing, even if you're pushing into that ledge of the handle a little bit, which you will be naturally if you're supporting your body, you're activating your core and upper body muscles. So it's not a passive tool, right? It's a very active, promoting active muscle engagement at every level of use.
Yeah. And I remember also watching like videos, not before and after, but people walking without the poles and then they walking with the poles.
Yes.
And how they are more confident, their posture looks better. They feel that sense of empowerment, because now they're able to walk with that good posture. So that was really cool to see the difference of how people walk differently, how their posture is different, their attitude is different, because they're able to walk with more support and they feel safe.
Absolutely. I think you've hit the nail on the head. This represents ability. There's a very different view on somebody using this versus another type of device. And while there's a time and a place for all of those devices, canes and crutches and walkers, the poles are a more active proposition. And I think the other important part is, in which we've experienced many, many times over the years, is you have the individual who, needs them for balance or whatever it is, gait retraining, orthopedic support, but it's something that they can also do with their partner, with a friend. Doesn't necessarily mean they're using the Activator poles. They could be using the urban poles, the angle technique, but they can do it together. And so again, when you think about maintaining and having compliance and sticking to a program, you're more likely to do that when you have a partner out there engaging with you. And this is something that's very, very inclusive.
Yeah. And I remember now the example of even performing like HIIT workouts with like a little more intense, but because you have that stability, you're able to perform more. So you can get more out of that, get more your heart rate, like all those benefits of exercising with a little more intensity because you feel supported. So that was also cool.
Absolutely. And when you think about in the case of like Parkinson's and all the research around the importance of increasing intensity, maintaining 75% of your target heart rate and all of those things, this is what allows you to do that, because when you're incorporating your arms, naturally that elevates your heart rate just strictly by doing that, let alone the full activity.
Yeah. And they don't feel, their perception is not as high, right? That they are as tired as their heart rate. When their heart rate elevates, they don't have that perception of being as tired because of the poles supporting them to reach that heart rate, right?
Exactly. That's exactly right.
Very cool. And one thing that I think was very interesting is just thinking about different devices like the walker, the cane, that you do have to lean forward a little bit. You're not able to maintain that good posture. Of course, there are times that you have to use it, but as soon as you can, it seems a lot better for the patient to be able to have something that gives them support, but maintains their posture. They don't have to lean in one side and do like that side bending with their trunk, or lean forward to reach for the walker. So like comparing to other devices, when it's safe for them to use the pulling, it seems like they benefit a lot from having a better posture and being able to, be supported in a good position.
Absolutely. And I think it's the fact that, again, you have that bilateral support. So you're getting that equal activation on both sides. And that's the thing when you're using a cane, again, over to one side, but also there's very little muscle engagement that's happening through that usage. Whereas with this, it is truly activating because of the resistance, the ledge, the push through the handle. It's activating all of those upper body muscles. It's allowing you through that downward pressure to support your body through an upward symmetrical posture. And I think that's really, really important. And, we've had our customer service team, we still answer the phone as much as we can. And so we have a lot of older adults contact us. And a lot of the times the feedback is, I don't want to be on one of those yet. They could be 90, they could be 100. And they resist the other devices because of the perception and honestly the stigma that, now this must be it for me. Whereas with these, they feel like there's still life in them. And I think that mindset is a significant difference. And I think today's aging consumer doesn't want to talk about the fact that they're aging. They want to do everything that they can to maintain their health. But this allows the people that really do need some support to feel like they can go out. They don't have to have that fear of falling. They can help to mitigate the risk of that through the use of the Activator Poles and program. But they also feel good about themselves when they're out. And so if you're feeling good when you're out, when you're using something like this, then you're more likely to do it again.
Yeah.
And I think the social aspect is really important too.
Those walking groups, right? That is cool that people go and walk together and as you said, their perception, I guess, that they are exercising and they're not. It's a lot better for them, more mobile and aesthetically and mindset, and using a walker versus using the pools. It seems cooler, right? There.
It is cooler. It is cooler. And, even when you think about travel, they pack up very easily. It's very easy to put them in the car. It's very easy to, take them on a trip, on a cruise. We've had many, many people, take them on holidays with them. Our poles are very well traveled because of the durability, the comfort, and again, the stability that they provide. And so, yeah, there is a big difference. And I think ultimately people just want to continue living their life to the best of their ability. And we're just really happy to support that in any way we can. And mobility is huge. And so anything we can do to keep people mobile and fit, that's really our mission.
And it's a lot more motivating to have a group of people to go for a walk with those pools than like, let's all get our walkers and let's walk together.
Exactly. Well, and that's what we've seen in the seniors living companies that we've worked with. Many of the physical therapy clinics have started their own programs leveraging this. And that's the thing about it from a business standpoint, is that this takes your business outside the walls of your clinic. You have visibility in your community by doing something like this, having the t-shirts, out, your branding is visible, but it gives you the reason, and it's a good reason, to be out with your patients.
Yes, absolutely. And what would you say is like an average age of your customers? Do you feel like they are the older population, or what do you think?
We cater to an older population, but I will say, like in the case of this month, we've partnered with the Vestibular Organization, and it's Balance Awareness Week. Actually, this week, you think about any kind of vestibular condition. I know myself, when I was pregnant, I had vertigo, and it lasted well beyond the pregnancy, and I was 30 at the time. And so when it comes to balance, it really knows no age, in terms of condition. Think about MS and so many people that are diagnosed so early in their lives. So our poles are used by people of varying ages. Even in pediatrics, there has been usage. But I would say, generally speaking, it is an older adult where, balance does become typically the number one concern. And so, yes, all ages can benefit, but I would say the older adult, you're right, is where probably the core demographic would be.
Okay. And now moving on to the urban pulling technique. So what is it and what's used for?
Yes. So the urban pulling technique, if you're basically healthy and fit with no major contraindications, the urban pulling technique is excellent. And I'll just explain, a little bit of the difference, even just by looking at one of the core features of the poles, which are these cute little booties. And you can see the difference immediately between these and the bell-shaped tip, right? So these are designed, they're on an angle to be able to push you forward. And so if you think about the difference in the technique, you're using the poles always on an angle so that you are going, being pushed faster, right? So your arms are propelling you forward. And that's something that it's a mindset thing. When you think about speed walking or running, your pace is dictated by how fast your feet and legs are moving. In this case, you have to let your arms lead. And that's where you're getting that lovely propulsion. And that's where that muscle engagement really comes into play. And you're getting that propulsion through your arms. And that's what's dictating your speed. So very often, if people enjoy walking and they add the poles, first of all, they find it more fun, which is the number one reason you'll continue, is that you're enjoying it. But secondly, they're getting that wonderful propulsion, the muscle engagement, the core muscle engagement, the upper body engagement. And that's where they start to see, again, that caloric burn increase, right? So up to 46% more calories burned by adding the poles to your walk, the urban poles. And you start to see body composition change. So you may not see it on the scale out of the gate, but you're building more muscle mass because, again, you're incorporating so many more muscles versus what you were doing when you were walking alone, because you have that resistance, because every time there's a foot plant, there's a pole plant, and you're pushing down through the handle. So it's significant in terms of the actual workout that you are getting by incorporating the urban poles. The angle technique is for a more, like I said, active consumer, active patient who's looking to increase their heart rate, improve their fitness. Here in Canada, our program has been incorporated at a number of cardiac rehab units because of the fact that, again, easily introduced in the clinic, easily translated to home, and can be monitored, very simply through even very basic devices to be able to monitor usage, to be able to monitor heart rate. And it's something that can be step changed. So, you can start off at a certain pace when you're first kicking off, and then you gradually increase week over week, continuing to increase intensity based on your point in recovery, if you think about cardiac rehabilitation. And actually, that's where, after I had my son, I had heart complications. And I personally used the urban polling technique as part of my cardiac rehab. And it was wonderful because if at the time you had said to me, with a 2-year-old in tow and then a newborn, you've got to get to the gym, you've got to get to this program, it would have been very challenging. And so the fact that I could, when the time was right, I wasn't allowed to carry him out of the gate, but when I could put him, in the front carrier and have her beside me, and we were just walking in the neighborhood, it was a wonderful experience for the kids. We were out and about together, but it was great for me because it wasn't something that I felt like it was extra to fit in. And I remember at the 9-month mark that I went back to my cardiologist, many times, but that was one of the key markers. And he said to me, what have you been doing? Because your body composition has changed. So many of the metrics that they were looking at had improved. And I'm not going to say this was everything. It's not the magic bullet. It's not the magic pill that's going to cure all. But it's certainly made a huge difference in combination with obviously healthy eating and all of those other things.
That's awesome. And I remember seeing also people going to walk their dogs with the pools, right? You can walk your dog and use the pools. They had like a belt or some adaptation. How was that?
A waist. You can purchase a waist leash. I will say, we always say it really is dependent on the dog and how behaved they are. So if you have a really good dog that's not all of a sudden going to, shoot out on you when they see a squirrel or something like this, then wonderful. When I first got our puppy, I would not have done it because he was just all over. He saw something and he'd want to jet out. And that's where you have to be careful because you never want to get tangled with the poles and the leashes and stuff. But a well-behaved dog, we have so many of our clients doing this. And it's amazing because, again, they're out and about and they're getting a better workout because they have the poles. And they also have the benefit of the stability. And I think that's the part where this is something that really is all season, all terrain. Because even if it is, a little wet out, you have the opportunity of taking off your tip, whether it's an activator tip or an urban pole, and you have the carbide steel tip. And so that allows you to, pick into a wet surface like wet grass or something. If you were on a trail, right, and maybe it was a little too rocky, you would just take off the tips, put it in your pocket or a little pouch, and you would continue on your way. Same thing here in Canada and certainly in certain parts of the US where the winter dominates half the year. It's a little bit slippery, a little bit icy. Also, everything with caution. You're probably not going in an ice storm anyway, with these, but a little bit icy out, you take off those rubber tips and you use the carbide steel tip to help to support you and allow you to continue moving all year long.
Yeah. And since you're talking about the tips, can you just change the tips to like do the urban technique and then the activator and use the same pole? Or the poles are different?
So the poles are different. So the activator poles do have higher offloading. They do have the button lock system as opposed to the twist. They have the 200 pounds versus the urban poles where you have about 90 pounds of offloading and a twist mechanism. And so there is a difference in the design. I will say for somebody using the activator poles, especially at early phases of a neurologic condition like Parkinson's as an example, you can take off the bell-shaped tip and replace it with the boot tip because at early phases of the disease, they may find the angle technique to be easier to adopt. But then as the disease progresses, we know that balance and gait will be more and more impacted. And that's where you want to be able to switch back to the bell-shaped tip on the activator poles because they're going to need that sense of stability longer term. So I would say, generally speaking, in a physical therapy clinic, the activator poles are the ones that you want, as your primary. Certainly the urban poles, to have one or two as an example, is helpful. And where it's really helpful, as I said, is the companion set. So you have, let's say, the husband that has had Parkinson's, has had a stroke. The wife still would like to do this alongside him. She may want to purchase the urban poles and he would take the activators and they could both do it together.
Okay, cool. And so the urban pulling, the technique, is to use when someone is not concerned about balance, right? If you don't have balance issues, then you could use to take more advantage of the increase of the heart rate and the more intense activity, right?
Absolutely. Absolutely. And that's the one really, like I said, my daughter was 3, when she started with it. So it really does expand. And we've had many programs here that have leveraged them, more on the wellness side, but even for mental health, to be able to get out and enjoy. I think about things like diabetes programs where, of course, we know glucose is absorbed in an exercising muscle. So the more muscles we're working simultaneously, the more glucose is being absorbed. This is where our urban polling program has really resonated. And of course, we have accredited education, whether you're looking for more of the urban polling side or the activator side. We have accredited education that allows people to embrace our courses. Certainly in the US for physical therapists, we're approved across all states for CCUs, and many options to take our courses, whether it be on demand, virtual live, or even live. Now we're beginning through our master trainer program. And then the same thing on the urban polling side, accredited through ACE and the American College of Sports Medicine. So there's many opportunities to be able to learn how to teach this and, really embrace it and offer it to your community and your patients.
Very good. And I mean, what I love about is that walking is so simple, right? And we know how important it is, aerobic activities, to many chronic diseases and everything. So you're just adding to like this simple activity that not anyone, but pretty much anyone can do. Walk around the block and just add to the activity, add more muscle recruitment and increase a little bit the intensity. So I love being able to build up on such a simple thing that's walk. So
absolutely. And if you think about every doctor in the world, the number one thing they recommend is walking because it is so accessible. You don't need anything fancy, but a lot of people say that they find walking boring. I don't, I admit I enjoy walking with and without my poles, but there is a different level of engagement and I guess adrenaline maybe, kicks in a little bit when you're using the poles, and that really makes a difference. And research has supported there is a higher level of compliance. So people are more likely to stick to a pole walking urban polling program versus an ordinary walking program. And I think that's, honestly, one of the key differences.
Yes, absolutely. And so who should not use the activator poles? What are the contraindications?
Yes, great question. So if somebody has been a long time walker user, definitely they would want to be working with a therapist to see whether or not the poles are even an option for them. So that's one major thing. And in some of the, like as an example, in some of the seniors living communities that we work with, some of the residents will never use the poles for ambulating. But what they will do is part of our polar size program where they're in a seated position and they're able to use the poles pushing down through the handle, still getting the resistance, but they will never be asked to stand up with them and they'll never be asked to walk with them. There are other programs for that. And so I guess the nice thing is that there are options for people who cannot ambulate or should not ambulate with them because they don't have the strength. They really need more to support them. But that's why it's really critical that you do get the advice of, a healthcare professional, a physical therapist, an occupational therapist in some cases, because you need to ensure, safety first. And so the number one thing I would say is if you are in a walker, you're going to want to look at that. Another thing you have to keep in mind is that this is directly impacting the shoulders. So any kind of acute rotator cuff issues, right, where you're obviously the movement is going to naturally impact that area specifically you want to be aware of. And in general, strength, right, overall strength and conditioning. Again, there's always options if you're not walking and ambulating with them. But those are some things that you want to consider. You do have to be able to grip the poles to a certain extent. So, very advanced stages of, let's say, rheumatoid arthritis, where perhaps, they weren't able to properly grip. That's something to consider as well. Although I will say for the majority of people with arthritis, this is a wonderful experience because of the ergonomic handles. And actually, the poles were vetted by the Arthritis Foundation in the US market. And we do have the ease of use approval because of the design and the fact that they are better than others for people that do have arthritis. But those are just some examples of contraindications. And I would just say that's the benefit of the course, is that it will take you through some other scenarios as well that you need to be aware of when you are recommending them to your patients.
And you can also exercise seating with them as well, just to give people more ideas. You don't have to just be standing and walking to use them.
No. And that's exactly it. Like, even from a seated position, if you're pushing down into the handles, you're still activating core and upper body muscles. And that's why it's so amazing for someone that, again, isn't able to ambulate, or even we've had, veterans where, in wheelchairs and things, and it's been something that they've been able to do to activate their upper body, also increase their heart rate, and still feel like they're getting a really good, exercise as a result of that.
So you mentioned the course. So if people want to find more information, learn more about it, where they can go?
Yes. So we have, our website, www.urbanpoling.com, and you would go to education. And we also have, and we can provide this, I guess, as part of an addendum to this, but we have a new learning management system where it highlights all of the courses that we're offering, certainly virtual live over the coming months. There's always the on-demand opportunity. And we do also offer, for multi-site locations, if it's something that you want to embrace across a number of areas, we can certainly customize pricing to accommodate for that as well. But otherwise, the individual user can go on and take a course immediately. You're shipped a set of poles and a pair of tips. So it's about $150 retail value of equipment that you're getting as part of the cost of the course. And then for a physical therapist, you are getting 4 continuing education credits as part of the course itself, whether that's on demand or virtual live.
Yeah, I did the on demand. It was very easy and a lot of good practical examples. So it's easy to understand and gives you lots of ideas of how you can use it and in different types of settings. So it's very helpful. So I appreciate that.
Thank you for that feedback.
And so if people want to find you or contact you, is there a way they can do, Deanna?
So they can always reach me directly. Certainly I can provide my email address and such as part of this as well. And our website is probably the best way. You can also find us on social media under Urban Poling Inc. for Instagram, Facebook, LinkedIn, Twitter, and now TikTok. We've just emerged. But really the best way is probably our website, and you can see a myriad of things. And there's also an opportunity to sign up for our newsletter. And that's where you can also get more information on our upcoming webinars, which is a wonderful way of learning. They're free of charge about the benefits of the program for a variety of different populations. Next week is how to leverage the program for different chronic conditions. It's being run by a seniors wellness specialist, kinesiologist. She's very high level here in Canada. And so just great ways to be able to learn more. And, there's no barrier to registering and then watching them later because they're all recorded.
Very good. You are all over all social media.
We're starting.
Very good. Deanna, thank you so much for taking the time to come here and share with us. Before we wrap up, anything else that you want to add?
No, I just want to say, I think, certainly, here in Canada where we started off, we are no longer the best kept secret. People know about us. In the US market, I would say we might be the best kept secret, and something that is highly practical for your patients and something that can really change lives for the better. That's been one of the main feedback we've had, is that this has been life altering. And so we really encourage you to explore it and to find out if this is something that will work for your patients in your community. And backed by over 350 studies, I'm pretty confident that you'll find usage just about through every patient that can come through your door. So really appreciate, Mariana, you taking the opportunity with us. Really appreciate the opportunity to be interviewed. And thank you for the collaboration.
Yeah, it was great to see like that feedback from the patients. I think that's the best part on like how much more confident they are because they are using the pulling, and hear how changes, like I was walking upright. My daughter didn't even recognize me because of that different posture, and then the confidence that it brings to them. So it was really nice to hear all the feedback. And I think that's what it matters. We're always trying to find things that are going to help us succeed in our treatments and help our patients. So that's what we want. We want to hear the feedback. We want to give them tools and empower them to feel better, to feel more confident, to be moving more, be more active. And I think that's very helpful.
Yes. Thank you. Thank you so much.
Thank you.